Source and share trusted information. When a new disease is discovered, a lot of information about this disease can come into our daily lives. But there can also be myths that are combined into the facts. During the COVID-19 pandemic, the World Health Organization called this an infodemic that can lead to misinformation that spreads like a virus. This leaves people confused about what sources they can trust for reliable information as they make decisions about their health and whether or not to get vaccinated. As a community health worker, you can share accurate information with people about vaccination and help them identify trusted information on their own. This is part of the important role you play to encourage vaccination and support community members through the vaccine process. In this video, we will identify several trusted sources of health information, outline steps to determine whether a message and its source are likely to be accurate or correct in the details they provide, discuss tips to identify reliable sources of accurate information on social media, and prepare you to educate community members on how to identify accurate information on their own. Sourcing trusted health information. As community health workers, it is important that we always share information that is based on true evidence and help to correct the false information or myths when we are asked by members of the community. We should also be honest when we do not know the answer to a person's question about something they have heard. But how can we be sure we have reliable information? The Internet is one way to access health information. Certain types of websites are most likely to share accurate information that is updated regularly to reflect the most current understanding of a disease and its prevention or treatment with information that is reviewed regularly by experts. These types of websites include health websites sponsored by the government. Their websites will have a .gov at the end of the website address. These could be Ministry of Health, Institutes of Health, Department of Health, or Centers for Disease Control and Prevention. Well-known universities that have a School of Medicine or Public Health. These websites will include a reference to education or academia in the website address, such as .edu or .ac. Certain large non-governmental organizations that promote human health. The World Health Organization is one example. UNICEF is another example. When you come across information from other sources, you can check the reliability by asking yourself the following questions. Who wrote the information? If you are able to identify an author, you can check their qualifications to report on a health-related topic. Ask yourself if this person or group is a known expert in the field, or if they are trained to make a determination. Check to see if the author is referencing scientific evidence and other trusted sources, such as those we have already discussed. Do their messages align or contradict those of the trusted sources mentioned above? Importantly, be wary if it seems that they have something to gain from false messages. They may be spreading disinformation. When was the information written? Look to see if the information is current or out of date. More recent information is especially important during epidemics, when information is rapidly changing. If you are looking online, a website will often list the date it was reviewed on the bottom of the page. Finally, is the material presented clearly and objectively? Stop if you notice major spelling errors or capital letters or extreme language, such as suggesting that something kills or is the worst option. You should also be aware of websites that flash advertisements or request you to share personal information or pay money. These can indicate deception in order to take advantage of the viewer. Today, many of the messages people hear come from social media. Social media is a powerful tool to share messages about our health, and trusted health information can be found on social media sites. But we need to be aware when we review social media posts to make sure that the information comes from a trusted source and is communicated in a clear and accurate way. Social media posts are often designed to grab your attention. If the message seems extreme or brings intense emotion, it may be misinformation. A good practice when you see a message you have not seen before is to stop and think about how we can check if the information is reliable. Then, read more than the headline. Headlines are often shocking to get your attention. Look for the entire story to understand more about the claim. You can use the questions we outlined before to determine whether the source of this information can be trusted. Whenever you see a new piece of information, look at multiple trusted sources to see if you can confirm that it is reliable. You might see if you can find the same information from your local Ministry of Health or from the World Health Organization. If it is difficult to find 3 sources, or if known trusted sources do not agree, you may be reading misinformation. While the news, internet websites, and social media can be useful tools for finding information related to vaccination, a discussion with healthcare providers is an important way to check the accuracy of this information. Keep in touch with your health ministry, local doctors, or clinic staff to make sure you are aware of details regarding vaccination and disease management in your community. So, what can you do? As a community health worker, you can provide accurate information about vaccination to your community and help people learn to identify accurate information versus myths on their own. When you interact with your community, make sure that you have the most up-to-date information about vaccination, side effects, and details for planning vaccination. Think ahead about those individuals who may have unique challenges in accessing trusted information. You can plan to address these needs with the resources available in your community. Continue to talk about vaccination whenever possible. Listen carefully to understand what type of messages people are hearing and where they are receiving their information. Use the trusted information you have and methods that you have learned to address their concerns with empathy and facts. Help them to dispel any myths with the evidence that has been shown to be true. Help people learn about reliable sources of information in the community. Use the steps we talked about in this video to give people skills to identify accurate information. Reinforce the importance to stop and think when information seems misleading, and suggest resources to follow up, such as trusted health workers like you, for additional guidance.